Hello, Vetaheaders! How you guys doing today? Doing good? Dr. Proença here, Vetaheaders. We're gonna have another darlings. Good morning, everybody. Good morning. Where are you guys from? Let me know here. I'm in the United States. And California. It's sunny. It's beautiful here today. And today I want to share with you one product, actually is a service that I'm obsessed with. I actually don't know how I practiced medicine before this because it is just amazing. Hello from India. That is amazing. What time is it there? I think you about, hello Virgo's group. How you guys doing today? Hello guys. Well, today we're gonna be doing another Vetahead Darlings. The Darlings is when I come here once a month to share with you either a product or a service. Fernanda, hello! A product or a service that makes a difference in my life and I really wanna recommend to you guys. And it's services or products that I actually use that actually are useful or practical for us, and always the focus as general practitioners and technicians, so to make our life way easier. And in times of AI, artificial intelligence, I could not lose that trend to actually talk to you guys about a service that utilizes some AI. And to make it very clear to all of you, full disclosure, I have no connection to this company and I make no money out of it. Cami, hello Cami. I'm here sharing with you merely because it will also change your life. In this service, I am going to recommend to you a service that I use, but I'm sure in your country, perhaps, or where you are, there are other similar services, but I can only recommend the ones I'm using. But I do want you to check in general. What I'm talking about is services of Scribe services. Are you guys using any scribing services? So scribing services, there are many different types of scribing services. The most traditional ones that probably a human doctor has used are the ones where there's a scriber walking with the doctor, right? A human walking with the doctor and typing everything the doctor says, all the interaction between doctor and patient. We do have those services. It's kind of warm here, guys, so I'm gonna actually take my jacket off. So we do have these services here in the United States. I don't know if you guys have where you're talking from. We have people from India now, but we do have the services here. Okay, that's a service that exists. And with this service, you need to have another human, right? So you need to have another human walking with you. And if you are a general practitioner, especially if you own your own practice, then you are familiar with the added cost for that. And again, all of these services, obviously, the doctor or the technician will need to review later on. There's nothing that will, of course, replace that step, right? The other services that also exist are the ones that you record your interaction with the owner or even dictate your say physical exam or the procedure you're doing. You save it as an audio recording and then you send it to the service and they have a human transcribing that. So the human is not present with you, but there will be a human transcribing all of that. And with the services, and guys, I'm talking about my experience. If you guys know of something different, let me know, okay? But in my experience, when that happens, it usually takes a day or so for them to send back to you the transcription, right, of your interaction. In my opinion, that's not very useful for me, because then the next day, if I'm not in the hospital, or I will need to log in and work, or a lot of times I need to send records somewhere, then records need to be ready, so that's not gonna help me. So, but that exists. And then the other segment of it, which is what I want to discuss here, are the services that are Scribe services that utilize AI, artificial intelligence. Guys, let me just start by saying It is insanely, at least the one I'm using, it's insanely good. Okay, insanely good. I'm talking to you guys about Scribe notes. Okay, Scribe notes. So Cami, if you want to put on the comments so people know, scribenotes.com. Let me show you guys. Oh, look how beautiful is my new computer cover. Okay, it's on is a website that looks like this. Okay, big microphone right here. Is also an app on your phone. So I of course utilize the app to record everything, although you could do the same with the computer. Guys, let me know here if you have questions, okay, about this service. So it's called Scribe Notes. What it does basically utilizes AI to not only transcribe everything you're saying, but to put in a SOAP format. For those that are not Americans, SOAP is subjective, objective, assessment, and plan, okay? And that's the format where the medical records go into the record, right? So basically subjective, for you guys that are American, I know, because I was unfamiliar with that concept when I came to the United States. So the subjective is the anamnesis. So when everything you ask the owner, the history taking, what the owner is, the complaints about the case, that's the subjective, right? That's why it's called subjective, because basically the owner's words and what the owner is telling you, right? Then objective is your physical exam, so it'll be your vital signs, everything about, you know, all the systems, musculoskeletal, neurological, etc., and all your findings. The assessment is what you think your differentials are, and you know, usually you have a conversation with the owner about that. And the plan is what you're gonna do in terms of diagnostics, what you have offered, the conversation. The plan is also in the client communication, and is in that part, like what you communicated, what you recommended, what the owner authorize you to do, what they decline. So all of that is in the plan, and any further communications you have with the owner also go into the plan. So again, that's the format. So it's called SOAP. Okay, subjective, objective, assessment, plan. So this app, let me tell you how it works. Okay, you subscribe to it. It's a paid service. Although when you subscribe to it, if I'm not mistaken, you have a trial period which includes 50 transcriptions, I think. Don't quote me on that. I know it does include some. And I think it's 50, so there's a trial period. So you go there, there's no credit card needed. You log in. It took me less than 2 minutes to make my login, and then you have then you have your own login, right? Your account. Then what I do is an app. It's very easy to use, guys. Seriously, it's incredibly easy to use. Then on the app, you're gonna have a big microphone like this, okay, on your phone. And you're gonna go into the room with the client, and you're gonna press a microphone, and you're gonna start recording everything. Very important. All this transcription services that include recording and audio, you do need to request permission from the owner, right? You just say, hey, I'm using this scribing service. Do you mind if I record this conversation? And usually you should be recording already to get the owner to say yes or no, so it's official that they gave the permission. Okay, so basically what it works, it's AI that looks like magic, right? You are recording the whole interaction. It doesn't matter if I had cases where there are two owners in the room and they are both speaking. A lot of times it's two owners, myself and the technician, all of us speaking, and it still works. So basically I go press record, and it's recording everything. I leave the phone on usually the table that I am examining the patient. So even sometimes there's an owner that's a little bit distant from me, the audio picks it all, okay? So I start my conversation, I start asking questions. Even if you are in a practice where the technician goes first, they can do that. They can also either download that on their phone and use, or you can give your phone for them to use. Again, whatever you want to do. But then they are recording everything, and then you asking questions, and then you know how it is, right? In the room is not necessarily everything following a specific step. You try as much as you can to make it an organized conversation, but a lot of times it's an organized chaos, right? Where, you know, you were talking about your findings and they have a question which gets in the middle, and it's fine. The app is gonna figure it all out, don't you worry. Even pleasantries, you know, because in the beginning I introduce myself, and you know, sometimes the owner will share something about their personal life, very common, right? And the app is able to actually, this is Coco, guys. She's there getting some sunlight and also talking. She wants to be part of this live, right, Coquito? And so the app will filter through all of that, okay? So all the pleasantries you're exchanging, everything, the app does filter that. So I'm there having my conversation. One thing that I do different now is when I'm doing my physical exam in front of the owner, before I would just write down the vital signs and my findings, right? I would go with a notebook and write down. What I do different now, I actually voice it. So of course the app can record that and then transcribe that. So I will say, you know, the lymph nodes are palpating normal. I'll say the heart rate is 300 beats per minute. The rest rate is 50. I'll say the temperature is 101. I'll say the abdomen palpates soft, or I do palpate a mass in the cranial abdomen on the right side. Anyway, the only thing I've done different is just voice things that I would otherwise write it down. Once you finish your interaction, you talk about the plan. A lot of times I say, you know, the nurse is going to come back with a treatment plan with the prices, and then we'll go from there. I discuss everything with the owner, and then you stop recording and you go back. Guys, I kid you not, in less than, and I'm going to show you this here, in less than 2 minutes, it depends how long your interaction is, I will then have it on the app already, right? So for example, this is the way, let me show you guys. So I had an interaction, and then this is the way it's gonna appear either on the computer or on the app, right? So you have here subjective, objective, right? And then objective, you can see it puts it as, I didn't say those things. I didn't say eyes, normal. I didn't put in sequence like that. The AI recognizes what I'm saying and puts in the categories that our physical exam need to have. Does it make sense? I didn't say, for example, musculoskeletal, normal ambulation. What I said during the appointment was the bunny is hopping normally. That's what I said, right? But the app puts in musculoskeletal, right? Respiratory, what I say is like, what I said during the appointment was like, the lungs sound clear on auscultation. I said the heart is strong, no murmurs, you know, and it puts everything. And if I didn't voice them, let's say I didn't mention anything about musculoskeletal, what the app will do is they will put musculoskeletal and they will put not mentioned, but it's still gonna be there, right? So which is very cool. So you can see it did all my objective, and the way also it does, look how cool. I'm gonna read it very quick, the objective. So in this case, there were 2 owners in the room with me, and they were discussing a lot of personal life stuff, nothing made into the record, okay? They were having some financial constraints. They were having some, another person in the family that was very sick, and they were sharing all of this with me. The app filters, the service filters all of that. What they wrote was, owner reports occasional lethargy in the patient, an intact male rabbit named blah blah, born on blah blah. The weight is 2 kilos. The lethargy has occurred once since the last exam, with a few instances when first acquired. The pet, the name is here, has a history of receiving meloxicam for these episodes. No drooling, sneezing, coughing, or significant ocular discharge reported. Owner mentions occasional eye drainage and has observed sneezing once. Guys, it literally summarizes in medical terms in the third person, right? It doesn't say he said, she said. It says owner reports. There were 2 owners in the room. They were both speaking, and there was me. And the app is able to pick up when it's me, the doctor speaking, and when it's them, which is awesome, right? And so after here, they come to assessment. So I talked to the owners about pododermatitis. I talked to the owners about you know, other things here and differentials. And then the plan, they were also that there for vaccination. So we talked about the vaccine for rabbit hemorrhagic disease virus. We discussed blood work to monitor kidney, liver function, overall health. It says it was recommended especially because this pet approaches senior age. Continue monitoring, educate. Then I did talk about the owner, how to clean the bunny. Is a senior bunny, is not able to, you know, clean itself or himself as they should because it has arthritis. And so it says here, educate owner on using hypoallergenic baby wipes for cleaning around the anus. So all of this is in here, guys. Like that, okay? So what also allows you to have is the recording itself. It gives you the audio, okay? So now I downloaded the audio and I also attached that to the medical record. Another thing, when you come here, you see these two tabs right here? One says show transcription. So when you click on it, it shows you the raw transcription, everything. So here, all the pleasantries are here, like word by word, right? So it's way more, way longer, right? And it's not in that SOAP format. What I also do is I download that and I also attach to the records. And anyway, as I was saying here, it's really, really cool. It also puts all of here for you, really useful. You can attach pictures, you can attach templates, say your husbandry templates, all of that you can have here. So now, how does it go from here to your electronic medical records, right? Or even say, if you don't have electronic medical records, I know in a lot of places there are no electronic medical records, you can also print this and attach to the physical record. But if you use electronic medical records, how does it go from this app or from the website to the electronic medical records? Is it going to be compatible with your electronic medical records? And that's one piece that I found amazing. It doesn't matter. What you're going to do is you're going to open your internet browser, go to the Scribe Note website, do your login, and you're going to drag and paste on your medical record. Doesn't matter which medical record you use, because now you copy and pasting. Isn't that amazing? And you can also do the edits, and you can review on the website itself, which is what I do. I review on Scribe Note. I change a few things, guys. Literally, it's a few things that I need to change, and it learns your patterns, right? Because it's AI. So the next time, those same mistakes are not gonna happen. And then you copy and paste. Isn't that amazing? Another thing too, you can also say you're doing callbacks, right? So let me find one here that I did, a callback to the owner. So as you can see here, it says callback, okay? So basically I did some blood work, I think in this case, some x-rays as well, because the patient was limping, and I called the owner back with results and my plan, etc. So I call the owner back, I put on speaker, and I record the interaction, and then guess what? The app transcribes everything for me. Isn't this amazing? And the other feature you can have too is when you are gonna create a recording, so you come here, create recording, right? And then you can, there's a tab here, I'll show you, and you can do medical record dictation, recap, callback. You can choose it, right? And there's also a dental record that they are in a beta phase here. So you can click, what do you want? Is this a medical record you're dictating? Is this a dictation? Is this a recap? For instance, I've done a whole newsletter for our community, which, by the way, if you're not yet part of our community, the enrollment is open for you to be part of the Vetahead community. Click in the link in the bio, you can enroll for a Vetahead community. And what the newsletter I just did for them, I dictated everything using this app. Isn't that amazing? Isn't that so amazing? So again, guys, I don't have enough good things to say about this service. I don't have disclosure. I don't have any connections with them. Although, to be fair, I do want to have connections with them, and I would actually love to be part of this whole thing. And the cherry on the top for me is that one of the co-founders of the Scribe Notes, it's a woman. It's a young woman called Emily. She's brilliant. She's a veterinary student, and with her best friend, they started this company. And I couldn't say better things about them. It's a subscription service, so you pay either monthly or yearly. It is a little, let me say this, it's not cheap, in a sense that, you know, I think it's, if I'm not mistaken, don't quote me, I think it's $165 per month if you sign up for the year. Oh my God, look who is here, my very good friend, Dr. Pardo. Dr. Pardo, we are talking about today's Vetahead Darlings. We're recommending services or products, and today I'm talking about Scribe Notes. Do you use Scribe Notes, or do you use any scribing service? Guys, Dr. Mariana Pardo, I love her. She's a criticalist. She's also one of the instructors for Vetahead, and she's an amazing professional in person. She's from Chile. So, as I was saying, the price, you can pay, I think, is almost $2,000 American dollars per year. It's like not 1,900 something, which breaks down to $165 per month. Or you can do the monthly cost, which I think is close to $200 per month if you don't want to sign up for the whole year. Now, let me tell you this, guys. This is something you can negotiate with your hospital manager to provide this service for you guys, because it's going to exponentially improve your quality of life. I guarantee you. And when I'm actually doing procedures, so say I was placing an esophageal tube, a feeding tube on a tortoise, I had the app there. I start recording and I was dictating my procedure. So by the end of my procedure, it was already on the app, the description of the procedure. So if you're doing a surgery and you have your phone there, you can press play and kind of describe and dictate to the app what are you doing. So at the end of your surgery, you already have your report. Same thing with the ultrasound. Same thing with anything you're doing on the back. You just need to record. And if you're not doing at the moment, you can also do it afterwards. Say at the end of the day, you sit there, you just dictate all the procedures you did, you know, and it saves you so much time. And if also, like, I go from practice to practice, I don't work in the same practice. So I have uploaded all my husbandry charts, everything that I use all the time. I have it on the app. That way I can just, you know, copy from the app and put in any medical record that clinic or that practice uses. So again, guys, I love it. I think it's super, super useful. I know there are other services too. I know there is a service called Talk-A-To in the United States. I think those are the big ones. There are other services that they promise there's a human reviewing everything. I'm telling you guys, if you're using a good service, you don't have to have a human reviewing. That's gonna slow down the process, right? AI is here to stay, guys. We need to embrace it. Okay, and this AI, it is, and the more you use, the more intelligent the AI becomes. Even if you wanna, you know, the way it said things, if you want to change that. But again, I am super impressed with this service I am using. The other thing that was also concerned is, would it pick up on my accent? Would it be able to pick up the words? Because I have a thick accent in English, and it does. Okay. At home with that robot called Alexa, I have many problems at home because she does not listen to me because of my accent. But with this service, it's spot on. I love it. I have not used Talk-A-To or other services. This is the only transcribing service I've used. And honestly, I have no reason to use any other because I just love it. And the fact that a young woman started this, is a co-founder, it says it all to me. Okay, so guys, let me know if you have any questions. These lives now, they are gonna be available on our YouTube channel, The Vetahead. Coco has a lot to say about it. We have the trash truck here now, and she's just talking to the trash truck. Let me see if I can show you guys her. She's right there on her perch. Wait, can you see her? Yes, Coquito. And then we have the tortoises here, guys. Let me show you the tortoises. What are they eating? Oh, I have the two little ones there eating. I don't know if you can see. Let me get my phone out of here so I can show you. They're so cute. Okay, let me show you them. They just had breakfast. Look. Oh my goodness, Matcha and Mochi. I know, Coco. Oh, I lost the microphone. There you go. This is Miss Coco. See, I have a lot to say. Anyway, guys, thank you so much for being here. Let me know, dropped my microphone. Let me know if you guys have used this system, this service before. Let me know if you like it. If you use any other scribing service, share with us here. Another thing that I want to know, are you using radiology AI? So share with us, let us know, and I hope you have a wonderful, wonderful day. Talk to you soon. Bye-bye.